Star Baptist Church in Mattapan to highlight a very important community partnership that's creating important access to the COVID vaccine in this community. I want to start first of all by thanking Bishop John Borders of Morning Star for hosting us, and I want to thank Kate Walsh, who's the CEO of Boston Medical Center, and Valdez, who's the CEO of Mattapan Community Health Center, who are the other two legs of this particular stool who are making this happen here in this facility. I've been to this church a number of times. I came as a private citizen because I had some friends who were members here. I came as a candidate. I've been here just to participate in services since we've been in office. Bishop Borders and the folks here were kind enough to open the doors for the interfaith service that we had before our second inauguration. This is a really special place in this community. It absolutely feeds the soul, but it also feeds the community physically in a variety of ways. This vaccination program is another example of its role in this community. People register to vote here. People do vote here. And it's great that BMC and Mattapan and Morning Star have come together to create this very special program for vaccinating folks here in this community. And I do have to say one final thing. I had made arrangements to come speak here in a traditional way, in a traditional service, in around January, maybe, of last year. And Representative Holmes is here as well, who is, I always see whenever I'm anywhere in this general vicinity for any reason, on anything. He's a wonderful advocate for these folks. But I made an arrangement with the bishop to come over and speak and be part of a traditional service here. And between the time that appointment was made and the time I came here, the pandemic had begun, the emergency order had been written, and the bishop and I talked about whether it made sense to come anymore, given that there wasn't going to be anybody in the church. And we made the decision that I should come and I should participate, because at the end of the day, people were going to need that sense of familiarity, whether it's in person or streaming, that so many, especially in a moment and a time of high anxiety, come to depend on. So this was actually one of the last places I visited in a traditional way, in a very untraditional circumstance, before this all really got going. And I just want to say how much I know the faith community across the Commonwealth has played such a major role in helping people weather the storms of the past year. And in addition to that, like what people have done here at Morning Star, been such big supporters of the people in their communities as people have worked their way through all this. And before I talk about the clinic here, I do want to give a quick update on what's going on with COVID here in Massachusetts. The Department of Public Health reported 1,428 new COVID cases yesterday out of a test population of 102,571. There are currently 760 patients hospitalized for COVID-19, 183 of which are in the ICU. Hospitalizations are down about 70% since they peaked in January. And the 7-day average positive test rate is at about 1.7%, which is down from around 8.5% back in early January. Vaccines, as of yesterday's daily report, about 2 million vaccines have been shipped to Massachusetts, and about 1.7 million have been administered, for an administration rate of about 85%. About 550,000 people have been dosed twice, and about 1.2 million people have been dosed at least once. Massachusetts currently leads the nation for first doses administered, per capita among the 24 states that have more than 5 million people, and we're number 7 nationally amongst all states for that particular metric. And by this point, we vaccinated around 90% of our long-term care residents, about 70% of staff in those facilities, and people over the age of 75, we vaccinated about 68% of that community. Over the weekend, we learned that Johnson & Johnson's vaccine was approved by the FDA for emergency use, and the introduction of that vaccine over time will certainly dramatically boost our vaccination efforts here and the vaccination efforts in so many other places as well. As people know, we have a lot more capacity than we have supply, and while demand will obviously be much more significant than supply, the good news here is having another effective vaccine for all eligible residents produced by a third manufacturer should mean a big increase in the number of vaccines that are available for first doses or single doses here in the Commonwealth. And we look forward to continuing to distribute vaccines through a number of different provider organizations across the Commonwealth. As I mentioned, new cases and hospitalizations have been declining now for about 2 months, which has enabled us to safely reopen additional parts of our economy. Today, the Commonwealth re-enters Phase 3, Step 2 of our reopening plan, and that means capacity limits for most industries have increased to 50%. Health protocols remain in place for all sectors, including requirements around masking, social distancing, cleaning, and a variety of other measures. The additional reopening measures are possible because of the positive trends we've seen in the public health data and the ongoing process associated with the vaccine rollout. It's obviously great to see the data moving in the right direction so that we can make it possible for people to reopen on a phased basis. The decision, obviously, to close down over the course of the past year at various points in times and restrict what people can do have been extremely difficult and have come with significant negative consequences of their own. But the data, as it's been reported for the past couple of months, shows we're heading in the right direction, and that makes it possible for us to make some adjustments. It doesn't mean, however, that people can or should let down their guard. Everybody knows what it takes. Wearing masks, socially distancing, washing your hands, not participating in a lot of informal gatherings with people who aren't part of your household bubble, and understanding and recognizing the caution remains the watchword here. But this vaccine is obviously a critical part of how we get to the next normal. And it's also critically important as we roll this out that we make sure we get to every community in the Commonwealth. We recognize that COVID hasn't affected every community the same way, and communities of color have been much harder hit. We've been constantly mindful of that fact throughout our response to the pandemic and this vaccine rollout. Starting with the Vaccine Advisory Group, which launched back in October, we made sure that voices from communities of color, faith leaders, and community health centers were well represented as we planned for the vaccine rollout. And throughout the early part of this year, we've launched a series of initiatives that were designed to ensure the vaccine rollout covers all of Massachusetts and is responsive to the disproportionate impact of the virus in certain communities. This particular clinic here at Morning Star Baptist Church is a great example of how we're working together to ensure that everybody has access to the vaccine who wants it. Boston Medical Center, Mattapan Community Health Center, and Morning Star are all trusted organizations in this community, and they work together to set up a site that launched last month. With this clinic, they're working to break down barriers to the vaccine and to improve health outcomes for people here and elsewhere. We recognize there's a hesitancy around the vaccine, and much of this hesitancy is born of generations of systemic racism and disproportionate access to quality medical care in Black and brown communities. These trusted neighborhood-based institutions are a key part of how we overcome that challenge. Since launching in mid-February, This clinic has administered over 1,000 vaccines, and as supply increases, the site will eventually have the ability to do about 500 shots a day. In a moment, Bishop Borders and Guale Valdez of Mattapan Community Health Center and Kate Walsh from BMC will talk about this unique and important partnership. Sites like this are a great example of how we can keep the focus on equity and support the communities that have been most impacted by the virus. We're committed to being an active partner to support these same goals. Just about a month ago, we launched a $2.5 million public awareness campaign to address some of the issues around vaccine hesitancy, and it featured a diverse group of clinicians who spoke specifically about the safety and efficacy of the vaccine. Almost all the research has been done, not just here in Massachusetts, but around the country, shows that medical experts are the most trusted voices when it comes to addressing concerns about the vaccine, especially among people of color. And we're grateful for all the doctors of color from hospitals across Massachusetts who stepped up to help us deliver this message. We also launched a targeted initiative that identified 20 of the hardest hit communities based on social determinants of health and the disproportionate racial impacts of COVID. And despite that limited supply we've had statewide, we've prioritized these 20 communities with continued shipments of first doses of the vaccine. We're also supporting existing outreach efforts in these communities with a $4.7 million program to increase awareness and access along the lines of what might actually look a bit like a traditional campaign. Those funds are going to be used to support two organizations, Archipelago Strategies Group and Healthcare for All, both of which specialize in this kind of outreach. The goal is to invest in community-based initiatives that support local residents and to work with local leaders to help get the word out, break down barriers, and encourage people to come get vaccinated in their community. We want to specifically focus on people of color, on homebound seniors, on disabled individuals, and other hard-to-reach populations. We've also invested $1 million in the Mass League of Community Health Centers to support similar work to increase vaccine awareness and disseminate culturally relevant educational materials in those communities that they support. And in partnership with the City of Boston, we launched a mass vaccination site at the Reggie Lewis Center to make sure people in communities like Roxbury and Mattapan had close access to a highly efficient, large-scale vaccine clinic. In the coming weeks, we'll continue to build on these initiatives, to continue to work to create trust and to promote access, and to always work with key partners who are on the front lines, who know these communities best of all. With that, I want to turn it over to Bishop Borders. And I thank you again, Bishop, for your friendship, your kindness, your grace, and your commitment to your people and to your community.
Thank you, Governor Baker, to all of you. Thank you, Lieutenant Governor, to Representative Holmes, to Kate Walsh, to Secretary Sudders, and to all of you here. I'd like to begin my remarks by saying that personally, I pray for the governor and the lieutenant governor on a regular basis. I believe that the governor represents leadership that is nonpartisan, and I believe that it's also open, his administration is open to the cares and concerns of the various ethnicities in the Commonwealth of Massachusetts. What we have found here is a wonderful partnership between Boston Medical Center, Mattapan Community Health Clinic, and Morning Star Baptist Church. I believe that this is and should be a model for many congregations and many local health clinics throughout the Commonwealth of Massachusetts and throughout the country. Because we are not just concerned for the spirit of people, we're also concerned about the healing and health of people's bodies. So here at Morning Star, we're still distributing food to the poor. On one side of the building, we're distributing food in our food pantry. On the other side of the building, we are extending ourselves for vaccination And here upstairs, we're giving away the gospel. The gospel for us is not just the preaching of the word, but it's liberation, it's healing, and it's deliverance for the total being. So what we do here is also a manifestation of our message. Morning Star is a statewide vaccination site, which means that there are people from all over the state who are registering and attending here at Morning Star to receive their vaccinations. That's something that I'm particularly proud of, because we find access for people who live in this community to walk across the street or catch a bus or have a family member bring them to receive vaccinations. But then we also find people from different communities and different parts of the state who are downstairs now receiving vaccination. So it does not matter the color of one's skin. All are welcomed here through Boston Medical Center, the Commonwealth of Massachusetts, Mattapan, and Morning Star. Every race, every creed, every person, they're welcome here to receive their vaccinations. What I've discovered is after people sit in the observation area after their vaccinations, there have been no side effects, no complaints. People are thankful to have this in their community, but I've not seen one person leave complaining about adverse side effects from the vaccination. So you can trust it. You can trust this church, you can trust these institutions, and you can trust this vaccination. People are doing well here, and people are continue to come. The numbers are rising more and more, and we're very happy. We're very excited about it. I was saying to the governor and the head of Boston Medical Center this morning, the partnership is such that I'll be sad when this partnership ends, but I'll also be happy when it ends, because that means we would have touched the people throughout Boston, throughout Mattapan, Boston, and the Commonwealth of Massachusetts, and made vaccinations available and seen or allowed to see the decrease of numbers who are dealing with COVID. This is also, finally, this is also a step for us that will lead to opening again for public worship. It's been nearly 1 year since we've been able to have a regular funeral or a worship service here. We've seen scores of people, scores from this congregation alone, die of the coronavirus, who are unable to have a regular funeral service for their loved ones. But by this effort, we'll be able to see very soon men and women coming back for public worship and coming back for any other services that our congregation provides. So thank you, please, once again, Governor, for your compassion and concern and your hard work daily. Lieutenant Governor, thank you. And to the partnership that we have, we'd like to thank you. And now I'd like to recognize for a moment Representative Russell Holmes, who represents this district.
Thank you, Pastor Borders. I have to begin with really the conversation that Pastor Borders ended with about how there's food coming out of one side of the building, vaccinations at another. And I was talking to Lieutenant Governor before we began, this is also where I vote. I live just up the street. So the multiple uses that this building is used for really speaks to really the value and the importance of Morning Star. We've had, unfortunately, some very bad incidents here in the neighborhood, and Morning Star has hosted, after we've had gun violence and things of that nature as well. This is really a center of this community, and one that is led by such an able minister, but also just a wonderful congregation. You feel welcome each time you come here, and it's just a great place to think about the vaccinations. And so when you think of it, James said we should count it all joy. And when you think of the fact that even as Pastor Borders said, he'll be both happy and sad, we have to count it all joy in that we have this opportunity to help others, but certainly we're going to be both happy that this has come to an end. I'm going to also just ask if we can just recognize Senator Nick Collins, who's here with us, and we also had Councilor Campbell, who was here. I can tell you it is all hands on deck, whether it be in the State House, whether it be at the executive branch and the House and the Senate. It is all of us. I can tell you that COVID has really impacted us in so many ways. I talk with the governor and his team constantly about unemployment, just you name it. Life has been uprooted in so many ways. And so when I think of today, and we have Guale, who serves on the board, or used to serve on the board with my wife, we have Kate, whose team has just been so wonderful, not just here at Morningstar, but with many health centers. The big difference here has been the conversation around this debate that's been happening around, do we look to have it so that we vaccinate the most amount of people, or do we look towards equity? And so the focus has been, in particular here lately with the Black and Latino caucus as well, has been, can we do both? We can actually do both. And I can tell you, when we were at the CIC folks over this weekend, you have to think about doing these things intentionally. You cannot sit back in the vacuum and think, hey, let's just try to figure out, when the governor talks about structural racism, many folks will still say structural racism doesn't exist. And I still have to come back, and I know it, folks get tired of me repeating it, but 400 years, 250 years of slavery, 100 years of essentially apartheid, 55 years or so since the civil rights bills, and quite literally you had the Nixon court, the Reagan court, and now the Trump court taking away whatever gains we had through the 60s. Still happening. And for folks to not understand what that looks like quantifiably, I have to still say, from a numbers perspective, structural racism in Boston looks quantifiably as $8 for every black person in wealth and $247,500 for every average white family. And so when you put things together like what we're doing here at Morningstar, they're critical. They are critical because of the fact that the community is going to do more than just vaccinate. We're going to feed. We're going to make sure we get the mask. We're going to do things that are going to be intentional about the fact that we believe structural racism exists. And so we are actually making phone calls. Kate and her team is literally saying we're going to have it so that although these vaccinations are open to everyone statewide, we are being intentional. We're being intentional about going out and phone calling and phone banking essentially to BMC patients to say, come here, the vaccinations are safe, as Pastor Borders said, and filling up our vaccinations with people from our neighborhoods. And so when I think about just the effort that Kate is doing, as I said, not just with Guale and his team, but all along Blue Avenue, from Harvard Street to Common Square Center to what's happening at Mattapan and what's happening here, this is vital. And so I just leave you with just simply saying thank you all for continuing to make this a priority. It is going to take intentional effort as we are trying to make sure we focus on communities that have been disadvantaged. I can't remember if I read it in the Globe or the Wall Street Journal, but there was just an article that says diabetes and COVID are two things that don't mix. And so we have to understand that here in this community with many, many folks who are diabetic, those two things are important, and there's an enormous amount of fear in this neighborhood. This is the blackest neighborhood in the Commonwealth. Literally 7 out of 10 folks in this district that I represent is black, 92% of our color, and has been disproportionately impacted. And so we need cornerstones of our district like Morningstar to do this. The other cornerstone, of course, is so many of my constituents go to BMC, and Kate, with her support and her team, with Guale from all of the, we don't do it anymore, but the boat rides and all of the other stuff over all the many, many years, she and her team has, again, just been phenomenal. And we're going to ask that she now come and just give a few words about what's happening with BMC and the entire team.
Good morning, everyone. Thank you, Governor Baker, Lieutenant Governor Polito, Secretary Sudders, Bishop Borders, and one of BMC's best friends, Representative Holmes. Boston Medical Center is really excited to partner with the state and so appreciative to work with Morningstar Baptist Church, the Commonwealth of Massachusetts, Mattapan Community Health Center to bring COVID-19 vaccines right here to the Mattapan community. We're appreciative of the states supplying us with vaccine, the most precious commodity right now. And we've opened 5 public clinics with our community partners in Dorchester, Hyde Park, Roslindale, the South End, and this amazing sanctuary in Mattapan. As you all know by now, Black and brown communities have been hit the hardest by COVID and are, for many good reasons, very hesitant to get the vaccine. At BMC, we've seen the tremendous toll that COVID-19 has taken upon Mattapan and neighboring communities. When BMC was planning to launch public vaccination sites, we wanted to choose locations that weren't just convenient, but also had a special meaning and evoked trust, particularly in the communities we serve. Morning Star Baptist Church has tended to the spiritual health and well-being of this community for decades. And in the past 2 weeks, partnering with Mattapan Community Health Center, we have vaccinated people who were baptized here, who were married here, as well as people who see Morning Star as an absolute pillar and champion for this community. Among our 5 sites, BMC is now delivering vaccines in a YMCA gymnasium in Hyde Park, a banquet hall in Russell Auditorium in Dorchester, and at this historic church right here in Mattapan. Think of all the great things that have happened in these different locations before COVID. Baseball leagues, weddings, anniversaries, and baby showers. We know the vaccine is a way to get our lives back. As a health system, BMC is deeply committed to and feels a tremendous responsibility to get the vaccine to our patient population in these communities, including here in Mattapan. We are honored to have the trust of everyone here and the community to help us achieve this important goal. I want to personally thank Reverend Borders and his Bishop Borders, and his fantastic team. When he said all are welcome here, he completely welcomed the BMC team. We can be a little chaotic and disorganized, and we worked together to get this site set up in record time. We could not have done that without the strong partnership of my friend Guale Valdez, he is celebrating his 12th year today at Mattapan Health Center. He started as the health center's CFO, now he's the CEO. Follow the money. And I'm really proud to partner with him. He runs a spectacular organization that literally is the heart and soul of Mattapan Square. Guale.
Thank you, Kate, and good morning to everyone. Access. Timely, equitable access without barriers. Access that is based on need and impact for communities that have been hit the hardest with this pandemic. Communities like Mattapan. Access for Mattapan. This is what our collective voices have said. This is what our voices in Mattapan, what the residents of Mattapan said loudly and strongly. And I want to assure you, these voices were heard by Governor Baker, who is here with us today to demonstrate his support for the work that is being done here. These voices were heard by his administration, Lieutenant Governor Polito, Secretary Sudders, who heard these voices as well and have affirmed their commitment to the work that we do. These voices were heard by Representative Holmes and also by Senator Nick Collins. Senator Collins, who would call my cell phone and say, I'm at your loading dock and I got supplies for you. They heard our voices. These voices were heard by Kate Walsh at Boston Medical Center, who has been such an amazing friend to the health center and is continuing to be an amazing and supportive friend. But Kate did something else. BMC did something else. The staffing that is done here in Mattapan is done by BMC. And these are by individuals who have full-time jobs in other areas of the hospital. But they are here today. BMC is here today to demonstrate their commitment to the work the important work that's being done here. And importantly, our host, Bishop Borders, who I'm getting to know. I'm inspired by him. I'm inspired by his commitment. And he is such a wonderful host every single day that this clinic is open. Thank you, Bishop Borders. Access. Access without barriers. Transportation. If you need a ride to get vaccinated, we will take care of that for you. Language. If you call us and speak one of the beautiful languages that makes Boston such a culturally rich city, we will provide translators. Cost. If you're worried about how you're going to pay for this vaccine, don't. There is no cost. The vaccine is given free of charge. One of the things that I have learned in this pandemic, I have a new definition of community. When we think of community, we think of the traditional definition. It's our neighbors, it's the individuals we worship with. I've expanded that definition personally. For me, community is now our elected officials who stand with us as we fight this battle. Community is now organizations that come together, our hospitals, Boston Medical Center, our churches, Morning Star Baptist Church, our health center, Mattapan Community Health Center, that come together to form this collective community to respond to this pandemic. We have been here since the beginning. All of us have been here since the beginning, and I can assure you, we will be here until this is done. I am so thankful. I am so thankful for this new sense of community and for the individuals who have come and responded to the voices of Mattapan and the residents of Mattapan and responded to this call for vaccines in an equitable manner, who have addressed our barriers to these vaccines. And I've always said that if I'm given an opportunity at a microphone, I'm biased and I'm going to talk about our staff. I am so thankful to work with the individuals that I work with. I see courage and I see dedication every single day, and that's what inspires me. This is what's happening at every health center. This is what's happening at every hospital. This is what's happening at every vaccination site across the Commonwealth, and I am thankful for that. This is about access, and this is about what happens when so many people, so many groups, and so many organizations come together for one common goal. And lastly, when I was coming over, one of our nurses stopped me, and I asked her how the vaccine clinic was going, and she said, you know, every time I give a vaccine, I receive this gratitude, just this big thank you for administering the vaccine. And she said, there is a feeling of hope. And that feeling of hope is also here at Morningstar, and it is at every vaccination site. That is what happens when we all come together. Access. This is about access for Mattapan, and it's about access for the Commonwealth. So thank you to everyone. Thank you for all that you are doing to support us. And we also know that we don't do this work alone. Thank you.
So do you guys have questions for these folks before I take questions?
Well, there's a strategy. The strategy is first to touch the community who is, or the age group of 75 and up. They've been very enthusiastic about this. They've been calling. What we've encouraged afterwards are those who are a little bit younger to let them know that if they show love and if they love their elderly, they're going to be vaccinated because they're younger. Some of them may be asymptomatic, and they're going to bring the virus to their elderly population. So that's also been an incentive to see the younger populations get vaccinated. But for black and brown men in particular, they're looking for trusted individuals to lead by example. So there are many doctors, clergy, in constant meetings, constantly speaking about the vaccination process, constantly taking the vaccination. I have not taken the vaccination yet. I have not taken it because I had COVID on January 1st. My wife and I had the coronavirus, so we were in quarantine. We quarantined for 21 days. And after that time, we came back to work. So just as soon as we complete that interim period where it's safe for us, I will be downstairs taking the vaccination. Now, as we're reaching very effectively the older population, we have another campaign to reach the younger millennial population. So we're making announcements. We are using social media along with BMC, along with Mattapan, along with the Commonwealth of Massachusetts. We're using social media, and we're making this a part of the church's life, and we're finding more and more people building trust.
Questions for some of these other folks?
Can I ask you about Dr. Fauci?
Yeah.
He made some comments over the weekend saying that he knows people want to get back, but we're almost at the finish line. He wishes governors such as yourself might wait another month or so. Have you considered that? I know it's too late now to probably go back, but were you surprised to hear his comments?
Well, the first thing he said this weekend that I thought was important was about the J&J vaccine. And his basic message was, all the vaccines are effective. All of the vaccines work. Take whichever one you have an opportunity to take when you're eligible and it's your turn. And I think that's an important message that needs to be repeated over and over and over again. With respect to every decision we've made about either restricting what people can do or letting up a little bit on what people can do, all of those decisions since the very beginning of this pandemic have been difficult. And they constantly get reconsidered and reevaluated and redebated as data comes in every couple of weeks by our administration and by some of the outside experts that we talk to. But at this point in time, with 1.2 million people in Massachusetts, many of whom are among our most vulnerable citizens and residents, having received their first dose, and 550,000 of those most vulnerable residents having received both doses, and having seen a drop in hospitalizations, positive case counts, and daily case rates generally that have all gone down over the course of the past 2 months by somewhere between 60 and 80%, depending upon which measure you're talking about. We felt, based on that data and the success of the vaccine rollout so far, that it was appropriate to make some adjustments. Now, the adjustments we made that are effective today basically go back to where we were last fall, before the second surge. And we'll continue to review the data every day and every week. And if we see stuff in the data that concerns us, we'll make adjustments again. But I think it's important for everybody to understand that this is a constant balancing act. And I think for us, at this point in time, based on the data, it made sense to make some adjustments with respect to reopening. But obviously, we'll continue to look at the data as we go forward, and as we have in the past, make adjustments in other directions if we need to, based on what happens.
So are you saying no informal gatherings, like don't let your guard down, don't do the informal gatherings? But how is that any different from eating 6 feet away from strangers in a restaurant?
Well, first of all, informal gatherings have usually very few rules. They can last 2, 3, 4 hours, 5 hours, 6 hours, the length of whatever the event might be. The mobility between and among people in informal gatherings is usually far more significant than it is based on the rules that we have in place with regard to how things are supposed to happen in more structured settings. People share food, people share drinks. Nobody wears a mask, generally speaking, in any informal gathering. The rules that are associated with almost everything that goes on based on formal activity usually involve staying in place, wearing a mask if you go anywhere, and limiting your exposure to only those people who are part of what we would describe as your bubble. And that's, generally speaking, been what people have done. And we have literally hundreds of inspectors who are out there checking up and making sure that people are abiding by the rules and doing the right things. And they've written tons of tickets, and they've even shut people down in some cases when they've seen activity that they consider to be significantly beyond the point of the rules. But there's a big difference between informal gatherings and the formal structured stuff that's part of the guidance that we've put out there for employers generally across a wide range of fields. So the information on the J&J vaccine at this point in terms of volume is a little bit up in the air. What I would say is that it is likely that we will get for next week a shipment, okay? And that shipment will probably be distributed pretty evenly across what we think of as the vaccinating community we have here in Massachusetts. But the message that's come from the feds at this point in time is, yep, they've made some. We will distribute those through our own channels and to you. Through their own channels, I mean, the CVS's and the Walgreens, the pharmacy channel that they've got. And then you should expect there will be a bit of a pause as they ramp up production, and you probably won't see really significant amounts of additional vaccine until later this month. No, I mean all of them. The regional collaboratives, the mass vac sites, the provider communities, the CHCs, they'll be distributed sort of according to how much we actually have, which in the short term will be limited.
How do you figure out where that vaccine goes? Like, would there be a section of Fenway for Johnson & Johnson? Because everyone has to get the same tech Johnson & Johnson.
Right.
How would that be kind of orchestrated?
Well, obviously, it's going to be up to the folks who are doing the vaccinating to separate what we think of as first and second dose from single dose. But the bottom line here is I go back to what Fauci said over the weekend and others said as well. These are all very effective. People don't need to pick one from another. People should get vaccinated. If you have a chance to get a vaccine, you should take it, whatever it is.
In terms of the anxiety that you talk about people feeling, would you say that J&J is going to be the game changer that really you've been looking forward to for, I think, for 6 months we've talked about J&J?
Well, the two things about J&J that are important, the first is it's a single dose, which for a lot of people is just a really big deal in terms of how they think about this generally. It also creates far more capacity within the system. And that's no offense meant to Moderna and Pfizer. The second thing about it is it doesn't require the deep freeze, right? So it's much easier to make it available in far more locations. Take mobility, for example. If you're in a situation where you have a vaccine that doesn't need to be thawed the night before and presumed to be available for a very particular number of doses the next day so that you don't waste any, if you have a vaccine that literally can travel and can travel in normal circumstances, you can just use it in a lot more settings that are not really built or structured to deal with some of the complexities associated with managing a vaccine that requires a deep freeze, a thaw, and then a general understanding of how many doses you're going to get out of that thaw and whether or not you have the people to actually to vaccinate according to the number you thaw.
Vaccine ban?
Sure, yeah.
Getting in the neighborhood?
You could do a lot of, right, exactly.
Governor Burke?
Does that suggest then that the Johnson & Johnson might be utilized in new ways? Not necessarily in that site, but our site, like that. Would it make sense then to dedicate the Johnson & Johnson to all the new areas that haven't been able to penetrate yet?
I think you'll see. I think one of the things you'll see with J&J is the ability to do certain kinds of things that would be hard to do now using the more the vaccines that come with a lot more criteria around how you can use them, how you have to store them, how you have to prepare them than the J&J one does.
Governor, during the hearing last week, the CEO of Mattapan said there were features available that could streamline the website that just haven't used for them yet. We spent a lot of money on this website, so are we going to be paying them more? Are we getting new features from them, or what's the status to improve the sign-up?
Well, I think the big thing associated with the website is twofold. Number one, to have more vaccine so that fewer people have to go on the site and find out that their number is 68,455 in line. That will be a function, hopefully, of having additional capacity along the way. The second thing, and I say this, just because somebody has functionality doesn't mean we necessarily believe it can work or scale for the size of the populations that we're looking to serve. We have a very strong tech team, and they kick the tires really hard on a lot of these vendors with respect to what they say they can do and what they can actually do. And I think it's important for people to recognize and understand that, and I've said this before, if we think certain things can enhance the performance of our site, we're going to pursue them. But they got to be able to deal with really big numbers, and they have to be able to deal with really big numbers in a really big hurry, because that's the way our site is set up, and that's the way it works here in the Commonwealth.
Is there anything in the Florida State Governor that take away as far as
There are several folks who we had a chance to say hello to who were in the recovery period, the 15-minute observation period is a better word for it, who were using either wheelchairs or walkers. And I think one of the things that this type of site makes available and makes easier for people, especially those who have who are older and have some issues with respect to mobility, is the ability to go to a place that's relatively nearby, pretty familiar to them, and to be able to go through the process in a pretty comfortable way.
Why not send the Johnson & Johnson vaccine to places like this? If it is easy, why not send it to these ones?
I think we probably will. What I said was that we're probably going to send them to a lot of places. And the big question will always come down to how much of either one do we have? How much Pfizer do we have? How much Moderna do we have? How much J&J do we have? And I fully expect you'll end up seeing them distributed pretty broadly across all of our locations. The last thing we want to do here is not put as much of what we get as we possibly can to work. But there's no question the relative ease that the J&J product has with respect to storage and preparation and use makes a difference with respect to how you think about where it can be used relative to the other two.
Is it also,
I'll give this to the bishop in a moment. I can't emphasize enough what Fauci said over the weekend, which is these are all completely effective against hospitalization and death. He said all three of them work, and people really need to keep that in mind. He basically said if you have access to a vaccine and you're eligible, take it. Do you want to speak to that?
Picking and choosing what company they're going to receive the vaccination, which vaccination is best, is not our concern in the urban area. Our concern is about hospitalization. Our concern is about sickness. Our concern is about death. So all these vaccinations keep people out of the hospital. They keep people from being sick for a long period of time. Anyone who comes here at Morning Star will not be asking, what vaccination product are you using? They'll be asking, can I get the vaccine, and will I have to come back? So whether they have to take 2 doses or 1 dose, it does not matter as long as we're cutting down death and hospitalization in this community.
There's a fair amount of research that's going on with respect to that. Some of it's already started in Israel. I mean, there are going to be lots. One of the things Fauci also said over the weekend was that no one's really tested these vaccines against each other. And one of the other things he talked about was the fact that they are just now studying whether or not people who've been vaccinated who come in contact with the virus might carry some of the virus with them, even though they will show no symptoms because they've been vaccinated. Does that mean those people may be contagious, right? There's a whole bunch of sort of second-level questions that scientists and researchers are going to study like crazy to figure out the answers to. And that's a good thing. But the one thing everybody needs to understand here is these vaccines work. And they as Bishop Borders said, they do exactly what they're supposed to do, and whether you need 1 or you need 2, people will be there to help people make that decision with respect to whichever one they access. But I fully expect by the time we get to the fall, we will probably have a lot more information about what the issue is with respect to a booster. And I don't want to speculate on it beyond that because there's a lot of work people are doing to try to figure that out.
can J&J be mass-produced, and do you think we're going to get to a point where maybe the majority of the vaccine coming into Massachusetts is J&J?
Well, J&J is a really big company, and they have a ton of manufacturing and production capability. I don't want to speculate on how fast or how much at this point in time, because anything I said about that would be speculation. But I would anticipate that by the time we get toward the end of the month of March, we're going to know a lot more about what the sort of flight plan for Pfizer, Moderna, and J&J in April, May, June, and July is going to look like. And that will tell us a lot about how to think about distribution generally, not just here in Massachusetts, but around the country. Literally, the message has been you will get a little bit of a supply based on production that's already been done shortly. And then basically, you should expect the next few weeks will primarily be Pfizer and Moderna, and then at some point, toward the end of the month, that's the most detail I have, as J&J ramps up its production capability, you will start to see a lot more of them come into the mix. That is literally, what I said is literally sort of what the message we got. Oh, it's definitely in the thousands, yeah. Say again?
At least one superintendent is calling for the J&J vaccine. Have you given any thought to earmarking this vaccine for people like that?
If you're eligible, take the vaccine that you get offered. They all work. I'm with Dr. Fauci on that one. Thanks, everybody. And thanks again, Bishop. Much appreciated.
Thank you very much.